pollution always was considered to be a silent, invisible kind of a killer, but now as we see, it's all visible now. From invisible to it's become visible, although it's still silent in terms of there's no noise that is being produced by it. But I think the noise that is being produced is actually being produced in the human body in the form of pneumonias, in the form of asthmas, worsening of COPDs. Many of these patients who are coming to us with cough, cold, persistent cough. There's a constant foreign body sensation in the throat, and patients continue to cough. In fact, this is also the time of the year when the AQI is so poor that the patients who have an underlying heart disease may just suffer another heart attack. There are studies which have shown that the percentage of cases reporting to the emergency during this period would be going up certainly. And of course, in the long-term impact, we all know that it reduces our total average lifespan. Quality of life becomes poor. You tend to become more prone to developing infections, allergies, lung cancers, brain strokes, heart strokes. So they can be, the implications of this poor air quality are very far and wide actually. So AQI more than 400 is definitely a hazardous sign, as you rightly said. And this is the time when it is between 300 and 400, we usually recommend that people who are vulnerable should not be moving out. But when it is more than 400, then anybody and everybody should be staying indoors as much as possible. And also maintain a good quality of air inside the houses. Avoid carpets, heavy furnishings, heavy bed covers. They all trap a lot of dust. Get your kitchen equipment in order so that there's not much of smoke coming into the rooms. Keep the bathrooms dry and clean. The dampness can also cause pollution. Then avoid lighting these camphors, ovens inside the houses. All that should be avoided completely. People going out for walks is highly disastrous, I would say, because the more you exercise outdoors, the more likely you are to be breathing in more toxic gases and developing complications. So it's very important to go away from the concept of walking outdoors, exercising outdoors. Whatever you're doing should be done indoors, as much as possible. So it's difficult to predict, but certainly that the AQI levels are not going to settle in the next few days' time. That is for sure. This will definitely take time. But even if you look at historically, the AQI levels during this period of the year remain much higher than the other, the remaining parts of the year, like the monsoons and the summers. But definitely they are beyond the WHO recommended standards at all times. So we should be prepared for a long haul. This is a situation where you should be going in for emergency measures, even if that entails going in for a lockdown of the city for a couple of days, which may help reduce the vehicular emission and public on the streets. One may have to resort to those kind of measures as well. So, basically you have to break down into the air pollution into two parts. One is the particulate matter, which is measured in terms of the microns, the 2.5 micron particle, the 5 micron particle and 10 micron particle. And then you have the toxic gases. So an N95 mask would protect you from 95 means 95% of the 2.5 micron particles will be prevented from going inside. But a particle size less than that can still go into your lungs, and toxic gases would still not be prevented. But of course, some protection is always better than nothing at all. So I would recommend that yes, if you're moving out and can wear an N95 mask, then you should wear an N95 mask. If at all, it's very important to move out. Otherwise, stay indoors as much as possible. See, air purifiers, again, is something very controversial because we don't have any large-scale studies to say that if air purifiers are being used, then the probability of developing lung infections, lung conditions, allergies, asthma, COPDs would go down. But one thing is seen for sure, that if people do use air purifiers inside the houses, especially inside the closed rooms where the doors are completely locked and the windows are sealed, there, at least even in night when they're sleeping for 7 to 8 hours, people who are vulnerable, like those who already have an underlying asthma, chronic obstructive pulmonary disease, where there's already an inflammation going on in the airways because of their primary lung problem, in them, use of air purifiers may reduce the inflammation to some extent and may make them less susceptible to worsening of their symptoms. So they're definitely worth trying. But then again, we must understand that you have to be actually living in sealed environment completely, where there is no transfer of air from outside to inside. That is the only way you can protect yourself, even with the use of air purifiers.